To begin with, we'd like to acknowledge the traditional owners of this land and pay our respects to their elders, past and present, as well as elders from other communities who may be here today. And in particular, recognise that there are people with disability here today, and say that we invite you in particular to ask us questions during the question time, or over lunch, dinner, or during the day tomorrow. We're very friendly.
Patsy can't make it today. There's some, she's an apology. There's just some stuff going on that she needs to deal with, so she does apology. Hi, I'm Emily Ardley. I'm from Gippsland, and I am here to talk about the SEXrurality course, and I am a peer educator, and I'm from Gippsland, and I have been doing this for how many years now? 8 years? But 8 years, yeah. So I'm here to tell you about the what I've been doing, what I've been learning, and different things. So thank you. I'll pass you on to Victoria now. Thanks.
Hi, my name is Victoria Cini. I'm a peer educator with Amie and Emily, and I've been doing it since 2015. And I've been learning heaps, and I've been really enjoying myself.
Thanks, Victoria. That's awesome.
Yep, thank you. So very kindly, Victoria and Emily have let me talk about this first part of our presentation, which I want to use to set some of the scene in how we think about our program, and in some of the ideas that ally with our program, and some of those which we actually challenge and work against. The first in the series on the Venn diagram up here is a circle, which is meant to look like a bubble, yeah, because bubbles are things we can pop, and it's got the word sexuality in the middle. And I don't need to talk to you about that. I don't need to talk to you about how gender and sexuality are constructed, or about how they're policed and managed in public discourse and in political life. I also don't need to tell you that we know what happens when within those boundaries, yeah, which are actually entirely fluid, although they're perceived to be rigid, when those boundaries are challenged, the sorts of actions that come about, yeah. The next circle on the, to the right, says disability. And I ask you to think about that because there's a thing I'd like you to consider now, and that is, in your professional capacity, if someone at work said to you, do you have disability access? I'd like you to think about what you'd say. And I'd then like you to think about what kind of prototype or stereotype of disability that promotes. So for example, you might have thought about a ramp, which is great. You might have thought about that time that you worked with an Auslan interpreter, which is great, yeah. But what we're going to talk to you about today, and which is actually in a separate circle for reasons I'll explain in a minute, is what is it to be accessible, inclusive, and in partnership in your community with people with intellectual disability. The other reason that intellectual disability is separated out from disability here is that in our experience and in our belief, a lot of the advocacy around sexuality and disability misses us out. It misses the point of intellectual disability. People with intellectual disability aren't visible in that forum. They're not always well represented in that space. Yeah? So there's an overlap, but we're also here to sit strongly and unashamedly and happily in that space, which is intellectual disability. There's a whole heap more circles, isn't there, that we could have, yeah? So our feminism is intersectional. So that means that we know that there are lots more things that people with intellectual disability are, yeah? Gendered, aged, located, of cultural and religious groups. Those are all really important things as well. But we only got 20 minutes, so I had to cut back on the number of circles. Today we're going to talk to you about our program, which is called Sexual Lives and Respectful Relationships. We're going to talk about two elements in particular: peer education, which Victoria and Emily are going to lead us on, and partnership, yeah, which happens with community professionals like you. If we can go on to the next slide. Oh yeah, thank you. Sorry, my back to the screen. Again, this is over to me. I just want to introduce you to our program model and explain to you these ideas of how we work. And at the same time as I do this, it would be great if you could go back to that question that I asked you earlier about how you provide disability access and start to engage with the ideas and the meanings that you're attaching to disability as we talk about those that we attach to disability. Yeah. So you can see here on the screen our program model is like an onion, and there's a series of layers that connect. At the very centre is our program, and it's a peer-led, peer education program for people with intellectual disability. It's about sexuality, relationships and rights. Supporting that in the next circle is learning partners and supports. We don't have time to talk about that today, but we will talk about the next layer of the circle, which is about sector development, capacity building and program partners. And over that is an area in which I mainly work, which is about research and development. Yeah. So program partners work alongside us in the program, don't they, Victoria? What sort of places do program partners work?
We work with people that are like the same age as us, and we go to different places and we run groups for people with all abilities, and we talk about sexual health and abuse and yeah.
And as Emma said, our program is about people being peers of people with whom we relate. And we unashamedly come from a position of rights, of capacity and of community access. But often, I don't know about you guys, but if I tell people what I do, I think they think I go and put condoms on bananas. And I don't know, have you ever done that?
Yes.
Yeah. Well, in our program we have it. I don't know what you do at home. We don't do that. We don't teach things. And if you're familiar with the space of intellectual disability and sexuality, you'll know that that's remarkable. We don't come to teach people the names for parts of their body, or the different slang words, or the rules about who you're allowed to hug. We don't do that. We have conversations. Yeah? And we facilitate opportunities for learning. We make local community connections. Yeah. And we're about rights, and we're about everybody who's in this program increasing their capacity and their skills. Yeah. The program runs in 10 sites, and it's a really interesting mix of sites, isn't it?
Yeah.
Victoria, can you tell us some of the places that you know where the program is?
I work for the Footscray Network. There's one in Footscray, Hobson's Bay.
That's your one. Yep.
Yeah.
So go through like we've got like Bendigo.
Then you go Gippsland,
Yep.
Frankston, Mornington.
Yep. Melbourne North.
Melbourne North,
Yep.
and Gippsland.
And hang on, what about the there's two in another state that in New South Wales?
I think in New South Wales there's Blacktown and Liverpool. Yes.
Yeah.
And there's 2 more overseas.
Yes.
Does anyone can think of where one of those is?
One is Sweden and I don't know the other one.
Sweden, in a municipality called Eskilstuna. I hope I've said that right, outside of Stockholm. And New Zealand has just started, has just received funding from the IHC Foundation to start translation of the program into a New Zealand context. So we go everywhere. We go from Bendigo, hello Louise, we go right through to Sweden and then over to New Zealand and out to Footscray and Gippsland. So what a great mix of places, hey?
Someone's got a question. Yeah.
Do you want to think of some examples where you've gone to deliver the training?
I've gone to Urella in Gippsland. I've youth centres. We've been to youth centres and just all around, and we've been to Cini and yeah. So.
What about you, Victoria?
I've been to Hobson's Bay, Leventon, Well, there's one starting today. In Broombank. And we went up to Mornington too. So, yeah, I think so.
They're mainly community type settings.
Why do we have program partners in our program?
The reason why we have program partners is to help each other out when we get stuck or if we get some words wrong or something, but it's really good to have someone with you because you can't do the program by yourself. You need someone to go with you so you feel safe and you know what you're doing. And there's also people from CASA, they come along too, they're counsellors for people that have been abused or sexually harassed or whatever, and they come in too, and if people are feeling upset in one of the sessions, they take that person out and they have a personal conversation with that person, or they make a time, they ring up and make a time for it too. So, yeah.
Also, people process different ways. They might pick up that other missed or something. So it's really handy in that way.
Program partners get a lot out of being on our program. Yeah, so they give support and they also learn stuff. Can you think of some things that when you've been training program partners or when you've worked with them in your groups that you think that they've learned and they've got out of being program partners?
Yeah. What we do in the books that we have, we do stories too. We do filming, and I was one of the film people in one of the stories. And one of the stories was Hannah's story. And I was actually being her in the video. And she has a boyfriend called Kevin. And he really looks after her and stuff and takes her out and takes good care of her. But sometimes they don't get privacy, so they have to go somewhere else to make love, or they have to get permission. Or when Hannah wants to move out, she can't because her brother won't let her because of conditions that she has. And another thing is that her tubes are tied, so she can't have kids. So that's another thing that she's had to deal with. But she's a really brave girl, so yeah.
Thanks, Em. That's a great example of the main content of the program is stories, and they're stories that were collected as part of research conducted about 15 years ago now at the Australian Research Centre in Sex, Health and Society. And so what we always say about those stories when we introduce them is, don't we, that they're true stories, but that things have been changed, like the people's names and even their football teams. So Em's given a great example of one of the 5 stories that we use, which is about Hannah. And after we listen to Hannah's story, we have a heap of key messages, don't we? And the key messages are things that we make sure gets talked about in the discussion. Yeah? And unfortunately it's a bit small, but you can see an excerpt on the PowerPoint here, which is some of the key messages from Hannah's story. And so, for example, messages there are about how Hannah and Kevin communicate about their sexual relationship and about the ability to say yes or no to sex. To finish up, the last thing we want to tell you about is how we work together in partnership with program partners and also with the organisations that they represent. We work with, I can't remember the number, but around about 35 program partners across Victoria, and they're from about that number of organisations. Yeah, Centres Against Sexual Assault, Community Health Services, Women's Health Services, Youth Services, local councils,
and
lots of other places. We love working with people. So Victoria, can you tell us a little bit about, well, first of all, tell us why you were peer educator.
I love helping people and telling them about to stand up for yourself and have a big voice and don't be afraid to use it. And I just love helping people learn stuff and teaching them better ways.
I'm really passionate about doing this because I love getting the enjoyment of people really getting engaged of the group and really putting the effort in. And so it's been really good for me too to learn some new things and And I'm really happy to be in this group because I got chose to be in the group, to be in group with all the other lovely people and I go to Sydney and I've got a story to tell, if that's okay with everyone. I worked with this lovely young lady from Mornington, and she was having some troubles with who she was inside. So I was talking to her and I said, no, I want to tell you who you should be. You should be yourself. It doesn't matter who you are or where you're from, just be yourself. And she cried, and then we both gave each other a hug because she was so emotionally surprised of what I said in the group. So it really made her think about, I can be this person. I don't have to please everyone else. I just got to please myself. So that's my story. Thank you. Thank you so much for having me. I love being here. It's really interesting to learn about different things. So thank you.
Thank you.
Anyone have one question for one? Oh, actually, yes. Yes.
I just wonder how your clients or the people who work with you come to your centres, or how do you gather the people to talk with? Like, what's the process?
Okay. So how have you told other people about the program that they could come and be in the training?
What we do is we promote it. We actually do a session before we do the groups. We ask people to come that are really interested in it, and then we tell them a little bit about what we're going to do, and so that's what we do. Yeah.
Word of mouth is also good, and for people who's done the training, maybe they talk to their friends about doing the program and they get interested, so yeah.
Yeah, word of mouth is fantastic. We understand that people with intellectual disability, and particularly people with complex communication needs or living in residential services, can be understood as a hard-to-reach group. What we do is work within a kind of community capacity building approach with experts to make those connections. So great examples of how word of mouth and how information sessions are ways that we can start to make that accessible. Yeah. Thanks everyone, and we hope you enjoy the rest of your day.